and members of the committee. My name is Taylor Hatch, and I have the absolute honor of serving as the director for the Agency for Persons with Disabilities. It is an honor and a pleasure to present to you today highlights from Governor DeSantis' focus on Florida's future budget for fiscal year 2024-25 for our agency. Before I begin, I'd like to thank Governor DeSantis and the legislature for your continued support, your continued commitment, and leadership in prioritizing Floridians with unique abilities by providing resources to best support this sacred population that we have the absolute honor of serving. I would also like to thank our providers, our stakeholders, and our partners throughout the entire state for their passion and dedication to serving our clients. As a system, we are focused on empowering individuals to thrive. To deliver on this commitment, we are building upon our strong foundation of a core service delivery model historically based on crisis response to a posture that will increase opportunities to serve individuals and their families at the earliest moment possible. Leading the way in amplifying these efforts, the governor's recommended budget directly supports the individuals and families we serve by funding multiple pathways, strategies, and initiatives. This includes $79.6 million to serve new enrollees onto our traditional and most recognized pathway, the home and community-based waiver, the iBudget Florida waiver, which provides a variety of behavioral, medical, social, and therapeutic services for eligible individuals. The focus on Florida's future budget also recommends $6.5 million to continue the investment in teaming models to serve individuals with developmental disabilities and a co-occurrence of a mental health diagnosis. In partnership with Secretary Harris and the Department of Children and Families, this pilot includes a co-response from subject matter experts, both in behavioral health and developmental disabilities, as a part of the existing mobile response team framework. We are incredibly thankful for the funding that was provided last session to fund this effort in Orange and Broward counties. This recommended funding for fiscal year 24-25 allows the continuance in those pilot counties, as well as it spans to Leon and Hillsborough counties. The governor's budget also recommends $800,000 to engage subject matter experts for the development and the implementation of a new and additional pathway called the Adult Pathways Waiver to serve Floridians with developmental disabilities. This waiver aims to support individuals by providing key services as they transition into adulthood to achieve greater independence and empowerment by providing necessary supports and services to meet varying levels of need, again, at the earliest moment possible to influence outcomes relating to health, safety, and well-being. Currently, individuals who apply for services offered through APD but who do not meet a crisis designation are placed in a pre-enrollment prioritization category based on their individual circumstance. We know from our data that the average age in which someone is enrolling onto the iBudget waiver in the last 2 fiscal years because of this crisis designation is 26 years old. Our data also shows that individuals that are ages 23 to 59 make up about 51% of those in a pre-enrollment category. The individuals that are ages 15 to 22 make up approximately 29%. This data, along with feedback directly provided by families all across our state, both illustrates and highlights the need to ensure that we preserve high school graduation for the exciting time that it should be for all Floridians, and to support the continuum of key services post-graduation. Specifically, working to ensure there is not a gap in skill obtainment and tapping into services that, again, empower individuals to thrive as they transition to adulthood. The recommended funding will support necessary subject matter expertise, including an actuarial analysis to be incorporated as a part of the waiver submission, which will specify the capped amount per individual available for these services. Eligible individuals would include those that are currently in a specified pre-enrollment category, are 21 years of age, or at the point of obtainment of that high school diploma, and who are eligible for Medicaid. The next item is a direct effort to ensure a thriving workforce, respond and support to our incredible existing providers, and encourage provider development within the system of care. The governor's recommended budget also includes $60.2 million in funding for iBudget waiver rate increases for providers of the following services. A 10% increase, which equates to an additional $2.6 million for supported living coaching services to ensure that individuals living in their own homes have a thriving provider network to gain and obtain skills needed to live on their own. A 10% increase, which equates to an additional $1.5 million for therapeutic services, including occupational, physical, respiratory, speech therapies, specialized mental health, and dietitian services. A 5% increase, which equates to an additional $16.4 million for all levels of life skill development services, which includes companion, supportive employment, adult day training, and pre-vocational services. And a 5% increase, which equates to an additional $34.8 million for residential habilitation services for individuals served in a specified community-based licensed living setting. And finally, this also includes a 5% increase, which equates to an additional $4.8 million for private duty nursing, ensuring that our rates are competitive. The governor is also recommending $709,000 to implement a workforce development apprenticeship program for direct support professionals that serve as our frontline team members working directly with our clients. These funds will support train the trainer sessions, utilizing existing certified curriculum for interested iBudget waiver provider agencies for funding availability. Additionally, these funds will cover the costs for the direct support professional to attend the training and provide a pay bonus for direct support professionals who successfully complete the program and gain the corresponding credential. What we have heard and what I have witnessed firsthand from providers who currently utilize this apprenticeship model is that this program has just truly evolved into a leadership academy. What we have seen and witnessed and heard are that the participants are gaining invaluable skills and creating a career path that, again, it supports the system of care in its future. And to support individuals, families, and provider development in rural areas of opportunity, the governor is recommending $350,000 to conduct a fiscal analysis to determine the funding needed to support a rate differential in these designated areas. This effort aims to support existing and spur future provider development. Members, we are so thankful to the governor for including these items and many more in the budget recommendations for fiscal year 24-25 to ensure Floridians with unique abilities and their families have the resources and supports to achieve their God-given potential to thrive. Thank you so much for the opportunity to be here today to present. Thank you for your continued support of the agency, the system of care, and most importantly, the people we serve. Thank you.
Thank you so very much, Director Hatch. And I know there's a whole bunch of questions. I know I have a couple. I just want to clarify something, though, with you on the for the pilot program, specifically for the pilot program. I know we had this a bill last year. I was kind of involved in the background of that, and I want to give us a little bit more detail on the pilot program and assure us that this is not taking funding out of the crisis wait list that we talk about so often. Give us a little more detail on that.
Thank you for the opportunity to do so. You know, I mentioned multiple pathways. The pilot program is an additional pathway that is a solution to speak to the denominator, that pre-enrollment category. And we've been working in partnership with ACA, and I know you'll see it in their budget going through in more detail. However, what I will say about that is we did request that is additional funding in addition to the funding for iBudget waiver, adult pathways waiver. That would be separate funding to help support that.
And that additional funding for the pilot program, we will see, it's my understanding, we will see it in ACA's budget.
You will see it in the budget documents being reflected in ACA's portion of the budget. And it also includes the additional funding to help support all of the areas that are authorized per policy.
So it will include both districts that we identified in the pilot program.
Yes, ma'am.
Not just the Miami-Dade area. It will also include the Central Florida area.
Yes, ma'am, in Monroe.
Thank you. I know we've had a lot of interest in that.
Yes, ma'am, thank you.
So you're recognized. Well, either one. Who wants to go first?
Great, thank you.
I've got 3 of them down
Thanks,
there.
Madam Chair. Director Hatch, I'm very excited about the Adult Pathways Program. For years, we have, as a committee, tried to create transitional pathways for foster kids. We've done that for years to help as they move into adulthood, make it easier for them to do everything from obtain a driver's license to stay on programs that are going to help them get educated. Talk a little bit more about some of the specific services for this vulnerable population. We always, our foster kids, those in a group home, we're always trying to do things for them. I think this really closely mirrors a lot of that for this population as they move from 18 into adulthood. What are some of the specific things that the Pathways program will help with?
Recognized.
Thank you for that opportunity. You're spot on. We are so excited about the Adult Pathways waiver for a number of reasons. One, it is another lever, another pathway to be able to support those individuals that have lifted their hand and said they need assistance, those that are represented in our pre-enrollment categories. And if you look at our pre-enrollment categories, there are a couple bubbles that occur, right? You have individuals that are under 21 years of age and individuals that are over 21. And the largest pre-enrollment category are those individuals in category 6, those that are over 21 years old. And I just mentioned that the average age in which someone is enrolling onto the waiver because they meet the crisis designation is 26 years old. So we know we need to develop solutions to support that individual. What we hear from families is, we have gotten services through the education system, through Medicaid. And so for us, it is just like the rest of Floridians that are so excited about high school graduation, we want to make sure that we are preserving that for the people that we serve. And so when we were thinking about a pathway to serve them, it's what are the services that we can provide that would help propel that individual towards independence and empowerment. And so some of those services, as you can imagine, are things like personal supports, supported living coaching, employment services, there are things like transportation and companion, those specified services to help, again, propel that individual towards their individual path, their goals, into adulthood.
Thank you, Senator Davis. We're going to limit questions. I'm going to end it at 1:15. So, and then I want to make sure every secretary is heard. So please go right ahead.
Thank you, Madam Chair. I'll be quick. Director Hatch, I heard you talk about the provider rate increases and 10% increases for support living coaches. Would that be the same as our support coordinators?
You're recognized.
Senator, that is different.
Okay. So is there any thought process behind the 10% increase for our support coordinators in consideration with the governor's budget, your budget? Are we getting there?
You're recognized.
Thank you for that question. And we appreciate very much the work that the waiver support coordinators do. They are a vital part of the system of care, and we appreciate that partnership. And we are also very excited about the rate increases for the other provider types that I named. I'd like to highlight a huge thank you to the legislature and the Senate committee in particular for advocating also for a rate increase for our waiver support coordinators last year at that 10% level. And we're very excited about that. I know that we have continued to work with the waiver support coordinator directly with coordinators and qualified organizations as a whole to help tell the story of how that funding helped support their workforce and network and show some of that data. What we are also thinking through, and we have a streamlining exercise in which we spent 20 hours directly with waiver support coordinators going through all forms, all pieces of the process of what could we streamline to help create capacity, help support them. We know the most high value interaction is them spending in time with the people we serve. And so that's also a lever that we've been working on over summer, to deliver for them in addition to the funding that they got last year. I would say that some of the components for consideration in the provider increases that were included were twofold. Those that would help support, again, empowerment for individuals, help promote independence, but then also kind of that look back of the historical rate increases over time. Some of our providers that were listed in here hadn't gotten a rate increase since 2011. So those are some of the components that went into that.
We did do 10% last year. So what I'd like to do is ask members to submit your questions to us. We'll make sure we get them to the secretaries, and we will make sure these get answered. If we have to have you back, we will. But I want every question answered. But I do want to respect that we have our various heads here. One quickie.
I have one more.
2 minutes.
Just giving you an opportunity. There was an article that talked about $432 million that had been unused for about 2 years. That equated to about $800 million. So giving you the opportunity to talk to us about that as quickly as you can, because that's money that went back. I know went back to state coffers and was never used. So we're dealing with dollars and cents. So let's talk about those dollars and cents that could be used in that article that's out there.
Very quickly, if you would
Thank you.
address it, and if you could give us
Absolutely.
perhaps a written response to that
Absolutely.
as well, so that we can make sure we have further detail.
Absolutely. Thank you for the opportunity to do that. First, I will say that APD takes very seriously the money that's been entrusted to us, to spend it as strategically as possible to maximize those dollars, making sure that we can support the largest amount of individuals possible with the funds that have been appropriated to us to support them. Two factors, I will say, that go into the components that you just mentioned that contribute directly to the flow of funding. Component number one is the point in time in which someone is enrolling onto the waiver. It occurs, periodically throughout the year, right? The second component is that we know that individuals typically meet their cost plan maturity by year 3. And so those two components are what is reverted and reappropriated in a non-recurring category, so that we can make sure from day one we're taking into account that delta and planning, making sure we're not overextending ourselves in future years if funding is not as flush as it is today.
We will get a further detail. If you would give us
Sure.
a really in-depth detail look at that, so you have all your questions answered.
Absolutely.
And we can certainly have the director back